My name is Tiffany Delane, and today I will be discussing healthcare disparities. So as Anita has already discussed, I have been a physician assistant for about 18 years and have mainly experience in emergency medicine with addition to correctional medicine at the Cook County Jail and Juvenile Detention Center. In 2018, I did get my PhD in public health. By the end of tonight's webinar, we would be able to discuss what are health disparities. We will also be able to discuss the differences between equality and equity, as they are not the same. We would also be able to discuss the social determinants of health and how it affects health outcomes, and what can we as physician assistants and healthcare providers do to provide and improve healthcare disparities and inequities. And then finally, the call to action. In the United States, 42% of African American or the Black population have hypertension. And of that 42%, 61.2% have uncontrolled hypertension. When compared to the white population, only 29.2% have it. And 51.9% of that have uncontrolled hypertension. We all know that hypertension leads to other things, such as renal disease and diabetes could also be a risk factor. In the United States, African Americans or the Black population, they're 48% more likely to be diagnosed with diabetes. They're 2.4 times more likely to be treated for end-stage renal disease, and 40% more likely to die from breast cancer. African Americans have a higher mortality rate when compared to any other race or ethnicity. Why is this? We all know that the World Health Organization describes health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health disparities exist when there are patterns of differences in health status and well-being across a specific population or group. And by seeing this, we can identify health inequities. In addition, healthcare disparities is the pattern of differences in access to health, maybe the quality of health that they're getting, the utilization of health services, and its outcomes. So I ask to you, is there a difference in equality and health equity? We know that equality is just a distribution of equal resources across the population. Health equity exists when everyone deserves this fair opportunity to be healthy. But we do have some inequities in healthcare when we have systemic barriers, unfair or unjust barriers that keep individuals or populations from being at their best and healthy state. So you may ask, what are some of the systemic barriers? So these are policies or practices or even procedures that result in people receiving unequal access or being excluded. So for example, they may not be eligible for a certain thing. You may have a lack of care or provider knowledge or skill set for this particular population or group. There may be a language barrier, and there may be no language line so that the patient understands what you're saying to them. They may not understand what's going on with their care. So we want to know, is equality enough? I ask you to take a look at this diagram for a second. We see on the left where there's an equal distribution of crates. Everyone gets a crate, but there's no equity. As you see, the shorter status person still cannot see the ball game. On the right, we do have equity, and where we have that, there's 2 crates stacked up for the shorter stature person, and this person now has equity. So what we learn is that just by distributing equal resources may not always be sufficient. we have to adjust those resources for the specific population or the specific community that we are serving. We all know that genetics plays a role in your health, but so does the social determinants of health. And these include things like where you live, your income, your education, your access to food and healthy options, your healthcare systems in your community, and also the neighborhood where you live. So we know that if you have or live in a higher socioeconomic status, you have a higher income, you may have access to better housing, better schools, you may have better hospitals and care facilities in your area. You may have more grocery stores so you can have healthy food choices. You have a car because you have better income. In comparison to those who may not have a higher income or live at a lower socioeconomic status. So these populations and communities have poorer housing conditions. They also may have more crowding in their housing conditions. The school system may not be as best as it could be. Hospitals may not provide better care. And there also may be poor work conditions. So sometimes people will take jobs at like factories or so forth, and that puts them at higher risk of having accidents. So we know that those of lower socioeconomic status have a higher risk of accidents. So we look at everything when we discuss health status because everything plays a role in your health status. When we take a look at the comparison of the median income, we see that the Black population has a lower income than the white population. The Black population has this study, first of all, was taken in 2017. And we see that the Black population, the average income was 34,210. And the white average income for the population was 61,637. And we already know, as we discuss about the social economic status and how the social determinants of health with income play a big role. So if you cannot afford your medications, sometimes the population will decide, do I take my medications every day or do I stretch out my medications and maybe I'll take one pill every other day or one pill every 2 days. And then when they come and see you, you wonder why the blood pressure or the diabetes is still uncontrolled. Also, we see that children living below the federal poverty level is higher in the Black population at 43%. And for the white population is 13%. And also, again, pregnant women who do not receive prenatal care is a higher rate than the white population. So in the Black population, 31% of women do not receive prenatal care. So therefore, there's a higher incidence of hypertension, diabetes, delivery and labor-related incidents in this population and in this group. I asked you, what is your life expectancy? There was a study that showed that your zip code determined your life expectancy. And this was placed in Time magazine. And they did all across the United States, including New York, DC. But here I just put the numbers for Chicago. And as you see, and also they noticed is that in some places by zip code, there was a 30% difference. So the zip code of 60623, which is near the north side of Chicago, the life expectancy was 85.7 years. In the 60608 area code, which is the near west side of Chicago area code, the life expectancy was lower at 68.9 years. And on the south side of Chicago, 60628, that population was expected a life expectancy of 65.8 years. As you see, there is a great span and a great difference in the life expectancy just based on socioeconomic status. We take a look at this picture again, and we notice that in this third picture, the fence is removed. So the systemic barrier has been removed in this image. So as a physician assistant, I ask you, what can we do for our patients? What can we do as providers? Number one, we can increase our awareness that it does exist. It's the first thing. We need to identify what inequities and health disparities exist in our patients. And we should learn how to empathize with our patients. For example, if our patient is late 10 minutes or 30 minutes, we shouldn't say, well, you're late, we're not gonna see you, we're gonna reschedule you, because that could mean that they won't come back or be on a schedule for another couple months. And we would not want this to happen. So we should try to accommodate our patients. So if they're late, maybe due to transportation, someone had to give them a ride, you have to take the train or a bus, we should try to accommodate them. Other things we can do as physician's assistant is to make sure that they understand what we are telling them about their health condition. Health literacy plays a big role with our patients. So we know that our patient education that we provide to them sometimes is written at the high school level, but sometimes we realize that the health literacy rate amongst our population, depending on what particular population you serve, may only have a middle school education. So they may not be able to understand, even though you give them patient education written with their paperwork, you may want to take time to discuss everything with them so that they understand. And it's always good to say, do you have any questions for me? Do you understand what I'm saying? Also remember that language barriers can play a role. If you speak one language and your patient speaks a different language, or they speak sign language and you don't, you want to make sure that you have a language line or some sort of language or telephone, or sometimes we even have like an iPad where we can reach out to a language line for sign language. So you want to make sure that your patients clearly understand you and that you understand that they know what's going on so they can play a vital role in their health. Another thing that you can do is to understand the cultural and religious beliefs of your patients. For instance, certain religious beliefs won't allow them to take blood transfusions, or you want to make sure that you understand what's going on and not just write this patient off as being crazy or that they're incompliant. And then also income. Everybody's patients may have different income status, but if the income is low or they're on the lower socioeconomic status, you may want to try to accommodate them by maybe writing for the generic brand of the prescription instead of the brand name, or maybe referring them to like the $4 formulary for prescriptions. So you want to try to accommodate them as best as you can and not write for the higher amount price prescription. Another thing you can do in your office is you can involve other departments. So if you feel like one of your patients may benefit from maybe social service or from the social worker, it's okay to involve them if it's for the better of your patient. You also may want to, if you want, to provide service to those who have been affected. So go to an area and maybe service that area where you feel like health disparities exist. In addition, you may also want to contribute to organizations and support initiatives that promote narrowing the health disparity gap. And finally, another thing you can do is just take on a special project in your office. I'm not sure if you'll be able to do this if you're like emergency medicine or something like that, or urgent care. But if you have a clinic or family practice clinic, someplace where you will see this patient again, you may want to set up some sort of educational class for hypertension, diabetes, nutrition, obesity, or something of that sort. Call to action. we definitely want to raise awareness. We need to identify that these disparities and inequities do exist. Without awareness, nobody feels there is a problem, and no one will work on obtaining the data and seeing where the disparities and inequities exist. We also need to develop evidence-based strategies that tackle these inequities. And this is a big call to action. And sometimes you cannot do this by yourself. So you do have to get in collaboration and partnership with policymakers, organizations, agencies, and sometimes public officials at the local, state, and national levels, and sometimes even on an international level. And therefore you can develop strategies and resources to help eliminate these health disparities and inequities. Another thing you can do is the call for increasing cultural competency training. And this is for the clinicians, the provider, but also for the office staff. Another thing that we can also do a call to action for is increasing diversity in the workplace, in governance, and in management. We must include this as well. I just want to give some acknowledgements to where I got some of the numbers from. Thank you. Are there any questions?
Thanks, Tiffany. That was really good. I want to just take a minute to go over our upcoming presentation. If anybody on the call has any questions, please put them into the chat function now and we'll circle back around. I wanted to let you guys know that our next webinar event is on Tuesday, June 30th at 7:30 p.m. Please join us for an important discussion about culturally sensitive care of sexual and gender minorities. And again, that's Tuesday, June 30th at 7:30 p.m. This topic will be presented in conjunction with the New York State Society of PAs. Their president-elect, Jonathan Baker, will be giving this talk in conjunction with IAPA delegate Don Martinez. So the goal of the presentation will be to help participants understand terminology necessary to support culturally sensitive patient care, and we'll discuss specific health needs of sexual and gender minority patients. Participants will also learn how to implement best practices into their clinical setting to welcome sexually and gender diverse patients. The webinar should be about 30 to 45 minutes and will be followed by a Q&A session. Also, I wanted to make you guys aware that for the remainder of the month of June, we're offering a membership discount to new members. New members can sign up using the code SUMMER2020. SUMMER's all in capitals. This will give you 40% off a one-year membership to IAPA. So that's our largest discount we've ever done. As you guys know, PA membership to IAPA drives our ability as a volunteer organization to speak and advocate for PAs of Illinois. IAPA is the only advocate organization in all of Illinois, and without this organization, many of the laws and regulations that currently allow us to practice would not exist. So with greater membership, we're able to do more as an organization. You guys can visit www.illinoispa.org for more information. Okay, just one question popped up here. Is there an email being sent out to the IAPA membership for this additional upcoming presentation? Yes, Heather, we will send out an email either tomorrow or Tuesday with the information about how you can register for that talk. We were waiting until after we finished this webinar, and we'll get the information for the next webinar out within the next 48 hours. Does anyone have any questions for Tiffany? So Tiffany, I just want to thank you. I think you put on a great presentation for us. I loved your graphics. I thought that they were very informative. And I want to thank you for keeping our collective community educated. We wish everybody health and safety in the weeks to come. Remember, IAPA is here to help with any questions or concerns you have in regards to practicing in Illinois. So thanks for joining us tonight, guys. We hope to see you on the next talk. Bye-bye.